Q9114-1. When is ear blockage most likely to occur? A. Upon descent and is aggravated by upper respiratory infection. B. During initial climb out as expanding air in the middle ear pushes the Eustachian tube open. C. During cruise flight as the pressure between the middle ear and aircraft cabin equalizes. The correct answer is A. During descent, the pressure in the cabin decreases, and this can cause a pressure difference between the middle ear and the cabin. If the Eustachian tube, which connects the middle ear to the back of the throat, is not functioning properly, it can result in an inability to equalize the pressure, leading to ear blockage. This blockage is more likely to occur when descending, and it can be further aggravated by conditions such as upper respiratory infections, which can cause congestion and inflammation in the nasal passages and Eustachian tubes. 9116. Which observed target aircraft would be of most concern with respect to collision avoidance? A. One which appears to be ahead and moving from left to right at high speed. B. One which appears to be ahead and moving from right to left at slow speed. C. One which appears to be ahead with no lateral or vertical movement and is increasing in size. The correct answer is C. An aircraft that appears to be ahead with no lateral or vertical movement and is increasing in size indicates a potential head-on collision situation. Since there is no relative lateral or vertical movement, it suggests that the two aircraft are on a converging path. Additionally, the increasing size indicates that the aircraft is approaching. This situation requires immediate attention and evasive action to avoid a possible collision. 9117. Scanning procedures for effective collision avoidance should constitute A. Looking outside for 15 seconds, then inside for 5 seconds, then repeat. B. 1 minute inside scanning, then 1 minute outside scanning, then repeat. C. Looking outside every 30 seconds except in radar contact when outside scanning is unnecessary. The correct answer is A. Effective collision avoidance involves maintaining a good visual lookout for other aircraft and potential collision hazards. The recommended scanning technique is to primarily focus on looking outside the aircraft, scanning the airspace in all directions. The typical procedure is to look outside for approximately 15 seconds, scanning the sky, and checking for any aircraft or objects that may pose a collision risk. After that, the pilot should shift their attention inside the cockpit for about 5 seconds to check the flight instruments and monitor the aircraft systems. This cycle of outside scanning and inside instrument check should then be repeated regularly. By adopting this scanning pattern, pilots can maintain awareness of their surroundings, detect other aircraft in a timely manner, and take appropriate collision avoidance actions when necessary. 9118. When using the Earth's horizon as a reference point to determine the relative position of other aircraft, most concern would be for aircraft A. Above the horizon and increasing in size. B. On the horizon with little relative movement. C. On the horizon and increasing in size. The correct answer is C. When using the Earth's horizon as a reference point, an aircraft that is on the horizon and increasing in size is of the greatest concern. This indicates that the aircraft is approaching on a collision course. It suggests that there is a high risk of a potential mid-air collision, and the pilot should take appropriate action to avoid it. 9112. A pilot is more subject to spatial disorientation when A. Ignoring or overcoming the sensations of muscles and inner ear. B. Eyes are moved often in the process of cross-checking the flight instruments. C. Body sensations are used to interpret flight attitudes. The correct answer is C. Spatial disorientation occurs when there is a mismatch between the sensory information perceived by the body and the actual orientation of the aircraft. Relying solely on body sensations to interpret flight attitudes can lead to spatial disorientation because these sensations can be misleading and inaccurate. The inner ear, which is responsible for providing information about balance and orientation, can be easily deceived in certain flight conditions. To mitigate the risk of spatial disorientation, pilots should rely primarily on the flight instruments for accurate information about the aircraft's attitude and orientation. By cross-checking the flight instruments and minimizing reliance on body sensations, pilots can better maintain spatial orientation and reduce the chances of spatial disorientation-related accidents.